Have you ever wondered about the difference between everyday fears and phobias? Well, to understand this, we need to dive into the complex world of anxiety. Anxiety, you see, isn't a one-size-fits-all phenomenon. It's more like a spectrum, spanning from the occasional jitters we all experience to debilitating phobias that can disrupt daily life. Anxiety in its milder forms is a common part of life. It's that flutter in your stomach before a big presentation, or the nervous anticipation when you're about to meet someone new. However, when these feelings become overwhelming, they may escalate into a phobia, a type of anxiety disorder marked by an intense irrational fear of something that poses little or no actual danger. Now, with the increased focus on mental health, the U.S. Preventive Services Task Force has recently proposed a recommendation for the screening of anxiety in adults. This is an important step towards early identification and treatment of anxiety disorders, including phobias. The goal is to connect individuals who show signs or symptoms of anxiety to the care they need sooner rather than later. So, while anxiety is a common experience, it's crucial to identify when it crosses into phobia territory. So, what differentiates everyday fears from phobias? Well, let's take a stroll down an imaginary lane. Picture this. You're about to step onto a stage, hundreds of eyes staring at you, waiting for you to deliver a speech. Your palms sweat, heart races, and a sense of dread washes over you. This, my friends, is a common everyday fear, the fear of public speaking. Now, imagine you're casually walking down the street and you spot a button lying on the pavement. You freeze, your heart pounds in your chest, and you cross the street to avoid it. That might sound funny to some, but for those with kumpunophobia, the fear of buttons, it's a very real and intense reaction. Phobias, you see, are more than just intense fears. They're persistent, excessive, and irrational fears of specific objects, activities, or situations that pose little to no actual danger, but provoke anxiety and avoidance nonetheless. Now let's dive a bit deeper. A fascinating study conducted by China's Second Military Medical University and Navy Military Medical University revealed a startling prevalence of anxiety, phobias, and other mental health issues among submariners in the South China Sea. The isolated and challenging conditions these submariners face, such as long periods of submersion and constant noise, can exacerbate anxiety, leading to specific phobias. This study highlights a crucial aspect of phobias. They often develop in response to specific circumstances or triggers, and the fear experienced goes beyond what's appropriate for the situation. In the case of the submariners, their environment led to phobias that wouldn't typically affect the general population. Therefore, the difference between everyday fears and phobias is not just about the intensity of the fear, but also about its impact on one's life. While everyday fears might make you uncomfortable, phobias can limit your activities and cause significant distress. It's like comparing a ripple in a pond to a tidal wave. Both are disturbances in the water, but one has a far greater impact. Now that we understand the difference between everyday fears and phobias, how do we cope with them? Well, there are various coping mechanisms that can be of help. Cognitive behavioral therapy, for instance, can teach you new ways to perceive and react to fear-inducing situations. Exposure therapy, on the other hand, gradually exposes you to the object or situation you fear, helping you gain control over your fear response. However, it's important to remember that if anxiety or a phobia is significantly interfering with your quality of life, seeking professional help is a must. Mental health professionals can provide you with the necessary tools and strategies to manage your fears effectively. And let's not forget the importance of self-care in maintaining our mental health. Regular exercise, a balanced diet, and adequate sleep can make a world of difference in managing anxiety levels. Remember, it's completely normal to experience fear and anxiety to some extent, and everyone does at some point. So don't be too hard on yourself. Take one step at a time, and remember, understanding your fear is the first step towards managing it.